Hello and welcome to the program. I'm Sophie Scott. Coming up, could you be suffering from celiac disease and not know it?
It took just 3 weeks before every one of my symptoms completely subsided, so you feel wonderful.
It's a common viral infection that's often harmless, but in pregnant women it can have dangerous consequences. Congenital cytomegalovirus, or CMV, can cause deafness, blindness and intellectual disabilities in babies. Many pregnant women don't know they've got it and there's no vaccine or treatment. But a clinical trial in the US using a therapy developed in Australia is looking at ways to stop it spreading. Rebecca Barrett reports.
Simone Graham gave birth to what she thought was a healthy baby girl 3 years ago, but soon after she found out Amelie was deaf as well as blind.
The first 12 months to even 2 years were a real emotional roller coaster. There was so much uncertainty.
Amelie tested positive to congenital cytomegalovirus, or CMV, an infection passed on from her mother who'd never heard of it. Amelie's eyesight returned and she's able to hear with cochlear implants.
We feel very blessed in that Amelie is probably the least affected of all the girls that I have met.
CMV is a common virus that generally causes nothing more than flu-like symptoms. Most babies who contract the virus have no lasting problems, but 1 or 2 are born every day with deafness, blindness and intellectual disabilities that might be able to be prevented.
This is more common now than Down syndrome in terms of live births. This is almost as common as cerebral palsy.
Doctors don't routinely screen for CMV because there's no vaccine or treatment. The only way to avoid it is through good hygiene and hand washing. But that could be about to change. A clinical trial in the US is recruiting pregnant women to test whether immunoglobulin prevents mother-to-baby transmission. An Australian company is donating the antibody therapy for the study.
The commitment that we're making is to try to get the data to answer this fundamental question as to whether this intervention actually would help women and babies with CMV.
If it's found to be a safe and effective intervention, a treatment could be available within 10 years.
If a death in the family is traumatic, the thought of them becoming an organ donor is sometimes too much to bear. Often relatives use their right of veto to overturn a relative's wish to be a donor. But that could all be about to end, with a push on to dramatically increase the number of life-saving organ donations. Adrian Rochella reports.
To donate life, the people close to you need to know your decision. Why? Because in the end, they will be asked to give the final okay.
And that's exactly what Kerry Tanner and Michelle Bradley did when their mother died 9 years ago. She donated 2 kidneys and 2 corneas to 4 recipients.
And it was Mum's decision to be an organ donor, and I don't believe we had the right to overturn her decision because that's what she wanted.
It was a unanimous decision. It would be like someone going against somebody's wishes in their will.
But many times relatives use their power of veto to overturn the donor's decision. The government is now calling for public submissions on whether to bring that to an end.
If I were in this situation myself, I would hate to think my family would override my wishes, but I do understand that that is quite a tough one for many families.
The Minister says she's also in favour of a single national donors register and dumping the system of marking driver's licences.
Scarring's gone down a lot.
The push is also on to encourage more living donors. Grain farmer Scott McCalman desperately needed a kidney transplant and his wife stepped up.
It was really quite amazing to be given life back. Dialysis was a process that it probably would have kept me alive, but the quality of life was very much diminished.
When someone's so sick, they don't have a quality of life, so to be able to give someone that life is just absolutely amazing.
Doctors say there's a lot of room for improvement. New South Wales has the lowest rate of organ donation in the country, and internationally, Australia ranks poorly too, with Spain, Belgium and the US leading the charge. The government hopes any reforms could be in place by the middle of next year.
When it comes to food and drink, it seems many of us still aren't listening to healthy eating messages. So to clarify what we should eat, health authorities have conducted the most comprehensive review of dietary guidelines in almost 10 years. The festive season is almost here, and for many that means willpower and healthy eating goes out the window. But experts say now is not the time to pig out. Instead, making good eating choices can substantially improve your health and well-being. To get the most up-to-date information, the National Health and Medical Research Council reviewed 55,000 scientific papers.
What this recent review has done is really confirm that Australians need to do more if we're going to decrease our risk of type 2 diabetes, cardiovascular disease and some cancers.
Australians need to double their intake of fruits and non-starchy vegetables and double the amount of whole grain cereals.
We need to be eating more milk, and particularly low-fat milk products such as yogurt and cheese.
And 40% more lean protein like chicken or fish. They found most people need to cut back on their red meat intake. And junk food remains a large part of the Australian diet. Researchers found more than 40% of what kids are eating is low in nutrients and high in sugar, salt and fat. And more of a third of adults' diets is made up of junk food.
It's very important that we look at this advice and accept the fact that we do need to radically change the way we eat.
Sweet and sugary drinks are also adding to weight gain and obesity. And while the holiday season is full of tasty temptations, experts say moderation is the key. It's a common condition, but few people know they have it. New figures suggest 4 out of 5 patients with celiac disease are unaware they have the illness. Australian doctors are being urged to be more vigilant. Alicia Dorrigan suffered a series of mysterious health complaints.
Drastic weight loss with no explanation as to why, because I was eating regularly. My hair thinned out, so I was losing quite a lot, and it was very thin around the front at the top here.
It took 4 years until she received a diagnosis of celiac disease.
It took just 3 weeks before every one of my symptoms completely subsided. So you feel wonderful.
Patients with celiac can't tolerate gluten, found in wheat, oats and rye.
It damages the lining of the small intestine, causing a lot of chronic problems like tiredness, fatigue, anemia, osteoporosis, a whole range of things a GP might see in their daily practice.
Australian experts say many patients with celiac don't know they have the condition.
We estimate only about 1 in 5 people with celiac disease has been actually diagnosed in 2011.
Specialists are urging GPs to be on the lookout for patients who might have the illness.
We need the specialists in these different fields to come together to produce a consensus statement, but we need a more systematic and I think in the end a centrally driven approach to getting on top of celiac disease.
At the moment, the only treatment for patients like Alicia Dorrigan is to avoid any foods containing gluten. It's commonly called writer's or musician's cramp, but it's a condition that's poorly recognised and difficult to treat. A South Australian researcher is hoping to change that as she embarks on a unique study using magnetic brain stimulation. Emma Rebellato reports.
Erin Mackenzie Christensen is one of 20,000 Australians who are believed to suffer from dystonia.
It affects everything from speech to being able to stand up and walk to, I need help with personal care and cooking and cleaning at home.
The neurological disorder causes involuntary spasms or twisting. When isolated to the hands, it can often affect musicians or writers because of their repetitive fine finger movement. People with Parkinson's disease or those who've had a stroke can also suffer the debilitating disorder.
Unfortunately, there's not very many known treatments. Some people are able to take medications and stuff like that, but for me, none of them have worked so far.
But that could be about to change. A new study will soon begin in Adelaide involving non-invasive brain stimulation, thanks to a $40,000 Brain Foundation grant. Dr Lindley Bratnam says unlike other studies overseas, her study will focus on a different part of the brain.
I'm going to be stimulating over the cerebellum, which is an area at the base of the brain that's very important for controlling movement, for coordinating movements and initiating and planning movements.
The study will involve 3 different types of treatments, and it's hoped patients will notice an immediate change to their hand function.
And if we can see a change just in a one-off acute session like that, then we're fairly confident if we then applied that in a future study where we repeated those doses, then we would get a more ongoing effect.
15 participants are needed here at the Repat Hospital for the pilot study, which is due to begin in the new year. It's then hoped there'll be some results within a few months.
Treating high blood pressure more aggressively can substantially reduce the risk of heart attacks and strokes. Doctors found it was easier to control blood pressure with higher doses of medication and more frequent consultations. Jan Morrison found out she had high blood pressure during a routine health exam.
I didn't have any symptoms, so I felt fine, and I thought maybe if I modify my diet, exercise more, it'll go away.
She was one of more than 2,000 patients with uncontrolled high blood pressure who took part in a study run by the Baker International Diabetes Institute in Melbourne. Half received the usual medical care, while the rest received higher doses of blood pressure lowering medication and more frequent visits to the GP.
We found that an intensified program of visiting your GP with intensified drug-lowering therapy did in actual fact achieve better blood pressure targets in those exposed to the intervention compared to your usual care with your GP.
Those patients treated more aggressively were 25% more likely to achieve their ideal blood pressure goal. As many as 1 in 3 Australians will suffer from high blood pressure, and it remains a major risk factor for heart disease and stroke.
So if you lower your blood pressure, you have a good chance of lowering your risk of a heart attack and stroke by at least 25%.
After taking part in the trial, Jan Morrison was able to get her blood pressure down.
I've got things under control, and I've taken positive action myself rather than just let it go on and deteriorate.
The study was run by the Baker IDI with support from a drug company. And that's all for this edition of the Health Quarter. Thanks for joining us. If you've got any story ideas or feedback, please get in touch on Facebook. Search for the Health Quarter page and click like if you want to be kept up to date. And I'll see you next time.